Hello everyone, I'm your host, Dr. Bob Lee, and you're watching Open. It's the only live interactive program that brings the Bronx and New York City straight to your TV set. We want to encourage you to stay connected to us. You can tweet us at BronxNet TV and follow us on Facebook at Open BronxNet Television. Leading off the show, our first guest is the Program Director and Project Hope at the Visiting Nurse Services of New York. He joins us today for a look at their work. We welcome Michelle Drayton. Welcome to the show.
Thank you, Bob. It's great to be here.
Yeah. Now, we've crossed paths before.
Absolutely. We've worked in the community together, worked with Harlem Week, around healthcare issues, children, mentoring. So it's good to be here with you.
Some of the things that the Visiting Nurse Services of New York are doing in our community.
Oh, the Visiting Nurse Service of New York, which we commonly refer to as VNSNY, they do tremendous work. They've been working in New York City, Bob, for over 100 years.
1893.
Something like that. Yeah. Started by a registered nurse, and her name was Lillian Wald. She used to cross the rooftops to get to people's homes. Wow. So they are the #1 provider of home care. And we provide acute care services, we do hospice and palliative care, which is the division that I'm in, and we just really help the community to remain healthy. So it's a wonderful.
Hospice and palliative care?
Okay, well, hospice is a very, very comprehensive program and a set of services for people who have advanced illness. Usually people who have a diagnosis or a prognosis, I should say, of 6 months or less to live. And oftentimes people sort of have a knee-jerk reaction to hospice as though it's some sort of scary thing. But really, hospice provides incredible services around pain management and comfort care. This is why I really want to promote hospice.
Yeah, because when people think of hospice, they think of, you know, all right, this is it, you know, I'm going to go here and they're going to give me some drugs and make me feel comfortable, and then it's all done. It's
a common theory, it's a common stereotype, and really it's a myth. Hospice doesn't mean you're giving up hope. It really means that you're actually sort of taking charge and making a decision. Not everyone who has, say, cancer or congestive heart failure or some sort of other problem wants to go with aggressive treatment. So hospice really gives the individual who's going through the illness as well as their family an opportunity to have care at home. And I've worked with many of patients that actually have been in the program for a year or two, and their quality of life, in fact, is better.
It's better.
So I say hospice is actually hope, and it's not giving up.
How does hospice and palliative care go hand in hand?
So hospice and palliative care, hospice focuses on comfort care and pain management during a terminal illness. Palliative care is also pain management, but you don't have to be terminal. So you can get palliative pain management even if you don't have a terminal illness.
And
so that's the distinction.
Yeah, and you don't have to go to a specific place.
Right. Palliative
you can do it in your home.
Well, palliative medicine is often provided in a hospital. Hospice care is usually, it's in the home primarily. Most people think you have to go to a place. That's another common myth.
Yes.
But actually it's primarily provided in the home. It could be provided in a nursing home setting. It could be also provided in an acute care setting. And the Visiting Nurse Service of New York actually has all of those different types of services. And we even have a residence for families or for individuals that perhaps don't have a home or cannot, you know, be cared for in the home. And so we have this incredible residence as well.
We admire your work, you know, over the years, you know, you always hear the Visiting Nurse Services of New York, you know, out there helping people stay comfortable and even bring them back from, you know, a place where they didn't want to be.
Absolutely, absolutely. We help a lot of people to get well. We provide physical therapy in the home. We provide skilled nursing services. So our aim is really to keep people healthy, keep people at home, and keep people out of the hospital. through our HOPE program, which is actually a hospice outreach program. What we're trying to do, Bob, is we're really trying to reduce the disparities, the differences in hospice utilization particularly among communities of color. Unfortunately, many African Americans, Latinos, Asians, Native Americans don't use the service.
Yeah.
And the service is part of your Medicare benefit, so there's actually no barrier to using hospice care. And it's incredible because you get this incredible team.
Why do you think there's a disparity in minority communities accessing hospice care?
Well, it's as you mentioned earlier, people have all these misperceptions about hospice. I'm giving up hope. You know, the doctor doesn't want to give me the best treatment. It conflicts with my spiritual beliefs. I should not be trying to quicken death. And so what we're doing is we're really going out, we're working in the Harlem community in particular, and working with healthcare facilities to educate the community about the benefits of hospice care. And what we're actually finding is that hospice not only improves pain management, patient satisfaction, but it actually reduces rehospitalizations and emergency room visits for patients who are really, really terminally ill. It helps people to be at home.
I can attest to that. I have a mom that's, you know, not doing too well, and she's under, of course, your care, visiting nurse services of New York, and she went into the hospital, came out, and that was last year.
And see, that's the great thing. The other thing about hospice is we want to focus not only on the patient, but the family. So we work with people, your family and other families, to actually have a plan of care in place for their loved one. And so that's the thing that's very, very different about regular hospitalizations. As you know, when people are in hospitals, oftentimes the family is not necessarily engaged in the plan of care. In hospice, you get a nurse coming to your home, you have an aide, you have a spiritual care counselor, you have volunteers coming into the home, and we're really working with the family to develop a plan of care.
Yeah. Here's a camera. Let people know and assure them that, you know, hospice is okay.
Sure. Well, I encourage everyone, people who are dealing with a variety of health issues, if you have questions, you can actually call us. Please feel free to call us at 212-609-1920. We focus on comfort care and pain management. There's no barrier to care. Even if you're a family member and you have a loved one at home who, you know, you want to know a little bit more about services, just give us a call, and we'd be happy to provide you with information.
What's that number?
It's 212-609-1920.
And can they navigate your website?
They can come to the website. If you go to vnsny.org, or you can just simply type in Visiting Nurse Service of New York, that'll bring you to the website.
Any last words before we wrap?
There's hope in hospice. And we encourage people to use the services. It's part of your Medicare benefit, and the services are really incredible.
Thank you so much. Give her a big hand, everybody.
Thank you so
Michelle
much.
Drayton, Program Director, Project Hope, Visiting Nurse Service of New York. Thank you.
Thanks,
Thank you
Bob.
so much.
Thank you.
And always come back, okay?
Absolutely.
You're
I'd
always
love to.
welcome.
Love
Yes.
to.
All right, we've got to take a quick break, but stay tuned. We'll be right back. I'll be back.